There is something I need you to understand before we go any further. Your liver does not have pain receptors. Let that sit for a moment. Unlike your heart, which can send a crushing signal to your chest, unlike your kidneys, which can produce sharp flank pain when something goes wrong, your liver, the largest internal organ in your body, the one performing over 500 separate functions every single day, cannot feel pain. It cannot send you a warning signal the way other organs can. It suffers in complete silence. And that silence, for adults over 60, is one of the most dangerous things I know of in medicine. Because here is what happens. The liver begins to struggle. Maybe it has been struggling for months, maybe years. And because there is no pain, because there is no obvious alarm, life continues as normal. Medications keep getting taken. The same foods keep getting eaten. The same habits stay in place. And the liver keeps falling further and further behind, compensating, adapting, doing everything it can to hold the line. Until one day, it cannot anymore. And by that point, the damage is far more significant than it ever needed to be. Not because the person was careless, but because nobody ever taught them what to look for. That is exactly what today is about. My name is Dr. Richard Whitfield. I have spent over 2 decades in internal medicine and preventive health, and I have watched this exact pattern play out more times than I can count. A patient comes in, sharp, attentive, someone who takes their health seriously, and we find that their liver has been under serious stress for a long time, quietly, without a single symptom they recognized as liver-related. The reason is simple. The signs your liver sends when it is struggling are almost never what people expect. They do not look like liver symptoms. They look like getting older. They look like being tired. They look like a skin issue or a digestive inconvenience, or just one of those things that comes with age. And that is what I want to change today. Before we go further, I want to ask you something. Drop a comment below right now and tell me your age and whether you have ever had your liver enzymes checked at a routine appointment. I read every single comment on this channel, every one. And the age and experience of this audience shapes what I cover next. So tell me, have you had that conversation with your doctor? Now, let us talk about what is actually happening inside your liver after 60 and why the stakes are higher now than they were even a decade ago. After the age of 60, the liver undergoes changes that most people are never told about. The liver's blood flow decreases by approximately 35 to 40% compared to a younger adult. Its ability to metabolize medications slows significantly. The regenerative capacity, the liver's remarkable ability to repair itself, which is one of the most extraordinary things in all of human biology, begins to diminish. And the liver's ability to process fats, regulate blood sugar, filter toxins, and produce proteins that keep your blood clotting properly all become less efficient. Now layer on top of that the reality of what most adults over 60 are dealing with. Multiple medications, NSAIDs for joint pain, statins for cholesterol, blood pressure drugs, sleep aids, all of them processed by the liver every single day. And you begin to understand why the liver of a 68-year-old is working under a fundamentally different level of stress than the liver of a 40-year-old. And here is the part that most people never hear. Many of the early warning signs that the liver is struggling do not come from the liver at all. They come from the systems the liver supports, from the skin, from the digestive tract, from the brain, from your energy levels and your sleep and the color of things your body produces. These are the signals most people dismiss, the ones that get blamed on age, on stress, on not sleeping well enough, on eating too much. But they are not random, and they are not just age. They are your liver trying to get your attention through the only channels it has. Today I am going to walk you through 7 of them, and I need you to pay particular attention to number 3, because number 3 is the one I see dismissed most often in clinical practice. It is the one that sounds the most like normal aging, and it is the one that, in my experience, gets missed the longest. Let us begin. Sign number 7. Your skin is itching. And there is nothing there. Not a rash, not a bug bite, not dry skin in the traditional sense, just an itch. Persistent, often worse at night, sometimes moving from place to place across the body. The arms, the legs, the torso. You scratch, and there is nothing to find. Most people reach for a moisturizer, maybe an antihistamine, and when those help only a little, or not at all, they chalk it up to aging skin and move on. But here is what is actually happening in many of those cases. When the liver is under stress, one of the first things that can become disrupted is bile flow. Bile is a digestive fluid produced by the liver and stored in the gallbladder. Its primary job is to help digest fats. but it also plays a critical role in eliminating waste products from the body. When bile flow is impaired, a condition called cholestasis, bile acids begin to accumulate in the bloodstream. And those bile acids, when they reach the skin, trigger nerve fibers in a way that produces itching. Not a surface itch like dry skin, a deep itch, one that does not respond to scratching, one that tends to be worse at night when the body temperature rises slightly during rest. A 2022 review published in the Journal of Hepatology confirmed that cholestatic itching is one of the earliest and most frequently overlooked signs of early liver dysfunction in older adults. Now, itching has many causes. I am not suggesting that every itch is a liver problem. What I am telling you is that itching without an obvious cause, itching that does not respond to normal remedies, itching that is persistent and particularly pronounced at night, that is the specific pattern worth paying attention to. That is the pattern worth bringing to your doctor's attention with the specific words, "I want my liver and bile function checked." Not just a general complaint of itching, that specific request. Sign number 6. Your eyes look different than they used to. Not dramatically, not alarmingly, just slightly. The whites of your eyes, the sclera, have taken on a very faint yellowish or cream tone that was not there before. Maybe you noticed it in certain lighting. Maybe a family member mentioned it. Maybe you are not even sure you are seeing it correctly. Do not talk yourself out of that observation. The yellowing of the eyes is called jaundice, and when it appears, even mildly, even subtly, it carries a specific biological explanation. It means bilirubin, a yellow pigment produced when the liver breaks down old red blood cells, is accumulating in the bloodstream rather than being properly processed and eliminated. In a healthy liver, bilirubin is taken up efficiently, processed, and sent into bile for elimination. In a liver that is struggling, this process slows. Bilirubin builds, and because it is a yellow compound, it begins to color the tissues where blood flows most visibly, the eyes first. Then, in more significant cases, the skin. Here is why this matters particularly in the over 60 population. After 60, many adults experience a very mild, chronic form of elevated bilirubin that stays just below the threshold their doctor would immediately act on. Not high enough to cause alarm, just high enough to produce a slight discoloration that comes and goes. That pattern, subtle yellowing that fluctuates, is not something to normalize. It is something to track and to discuss with your physician with specific reference to liver function. A study from the American Journal of Gastroenterology found that adults over 65 with even mildly elevated bilirubin levels had a significantly higher rate of underlying liver fibrosis than their normal bilirubin counterparts, the majority of whom had no idea. Look at your eyes in good natural lighting this week. Not fluorescent bathroom lighting, natural daylight. Compare to a photograph from 2 or 3 years ago if you have one. Your eyes are one of the most honest reporters your liver has. Sign number 5. Your digestion has changed. Specifically, you have noticed changes in your stool that you have never mentioned to anyone because it felt too embarrassing or too minor to bring up. Pale stools, clay-colored stools, stools that are greasy or that seem to float more than they used to, stools that have an unusually foul odor that is different from what was normal for you before. I want you to know that these observations are not minor. They are among the most diagnostically valuable things a physician can learn about what is happening in your digestive tract and in your liver. Here is the biology. Bile, produced by the liver, is what gives stool its characteristic brown color. When bile flow is reduced or obstructed, that color changes. Pale or clay-colored stools are a direct visual indicator that bile is not reaching the digestive tract in normal amounts. The greasy floating quality has a separate but related explanation. Bile is essential for the digestion and absorption of fats. When bile is insufficient, dietary fat passes through the digestive system incompletely absorbed. The result is stool that contains excess fat, a condition called steatorrhea, that produces exactly the floating, greasy, foul-smelling presentation I described. Over time, this fat malabsorption creates a secondary problem. The fat-soluble vitamins, vitamin A, vitamin D, vitamin E, and vitamin K, all depend on fat absorption to enter the body properly. When fat absorption is impaired, these vitamins become depleted, and the downstream effects, poor bone health, compromised immunity, problems with blood clotting, neurological changes, can appear to be entirely unrelated to the digestive symptoms that cause them. Please do not be embarrassed to discuss these observations with your doctor. What you are describing is not a minor inconvenience. It is clinical information your physician needs to hear. Sign number 4. You are bruising more easily than you used to. or small cuts are taking longer to stop bleeding than they once did. You bump your arm on a door frame and a bruise appears where one never would have appeared before. A small cut from cooking or gardening keeps bleeding past the point where it should have stopped. Most people attribute this entirely to blood thinners, to aspirin, to aging skin that has become more fragile and transparent. And while all of those things are real factors, there is another explanation that should always be on the list. The liver produces the majority of the proteins involved in blood clotting. Fibrinogen, prothrombin, and several other clotting factors are manufactured in the liver and released into the bloodstream to be available when bleeding occurs. When the liver is under significant stress, the production of these clotting proteins declines, and when clotting proteins decline, even minor injuries take longer to heal. Research published in the journal Liver International showed that impaired clotting factor production is present in a measurable percentage of adults over 65 with early-stage liver disease, the overwhelming majority of whom had never been diagnosed with any liver condition. There is a simple blood test called a PT, or prothrombin time, that measures how efficiently your blood is clotting. If you have noticed new or unexplained bruising patterns or prolonged bleeding from minor cuts, this is a test worth requesting specifically, not as a panic response, as a specific, targeted clinical question. Sign number 3. And this is the one I told you to watch for. This is the one I see dismissed more often than any other. The one that sounds the most like normal aging. The one that gets patted on the shoulder and sent home with a multivitamin. Persistent, unexplained fatigue. Not the kind of tired that improves with rest. Not the fatigue that comes from a demanding week and resolves over a weekend. The kind that is there in the morning when you wake up. The kind that is still there after 8 hours of sleep. A deep, heavy structural exhaustion that has become your baseline and that you have slowly stopped mentioning because everyone around you just says, well, you are not as young as you used to be. I need you to hear this very clearly. That kind of fatigue is not a normal part of aging. It is a symptom, and one of its most under-recognized causes is a liver that is operating under chronic stress. Here is why the connection gets missed so completely. Fatigue caused by liver dysfunction does not feel like what people imagine a liver problem would feel like. There is no pain in the upper right abdomen. There is no obvious digestive complaint in many cases. There is no yellowing. There is just an overwhelming tiredness that has no clear explanation. The mechanism is straightforward once you understand it. The liver is responsible for converting stored glycogen into glucose and releasing it into the bloodstream to maintain steady energy levels. It is responsible for clearing the bloodstream of ammonia, a toxic byproduct of protein metabolism that the brain is extremely sensitive to. When the liver is not clearing ammonia efficiently, even at levels far below what would be clinically recognized as hepatic encephalopathy, the result is a subtle but constant cognitive and physical heaviness, a fog, an exhaustion that sleep does not fix because sleep is not the problem. A landmark study published in Hepatology, which followed more than 4,800 adults with varying degrees of liver health, found that fatigue was the earliest detectable symptom in patients who later developed significant liver disease in 71% of cases. 71%. And in the majority of those patients, fatigue had been present for an average of 3 years before any other liver-related finding appeared on testing. 3 years of fatigue, dismissed, attributed to age, to stress, to not sleeping well enough. If you have been tired in a way that feels different from normal tiredness, if you are tired in the morning as reliably as you are tired at night, if sleep does not move the needle, please do not accept age as the explanation without first asking your doctor to run a comprehensive liver panel. A basic metabolic panel, an ALT, an AST, a GGT, a bilirubin, and an albumin level. Those numbers together give you and your doctor a meaningful picture of how your liver is actually functioning. The test is simple. The blood draw takes minutes, and the information it provides can change everything. Sign number 2. Your abdomen is changing in a specific way. Not your weight overall, the distribution. You may have noticed increased fullness or bloating in the upper right side of your abdomen, just below the rib cage, or a more general sense of abdominal fullness and pressure that was not there before, particularly after eating smaller amounts than you used to. In more significant cases, there may be visible distension of the abdomen, a swelling that is not related to weight gain and does not respond to dietary changes. This is a condition called ascites, which is an accumulation of fluid in the abdominal cavity, and it is a sign of more advanced liver dysfunction. But I want to focus on the earlier, subtler version, because that is where most people's experience sits. A sense of fullness an upper right abdominal heaviness, a feeling that the stomach is crowded by something even when it is not full. The liver, when it is inflamed or enlarged, can produce exactly this sensation. The liver itself occupies the upper right quadrant of the abdomen. When it is under stress, when it is accumulating fat, as in non-alcoholic fatty liver disease, which affects a staggering number of adults over 60, or when it is beginning to show early signs of fibrosis, it can enlarge enough to create a noticeable sense of pressure or fullness in that area. Non-alcoholic fatty liver disease, now called metabolic dysfunction-associated steatotic liver disease, affects an estimated 25% of the global adult population. In adults over 60, that number is significantly higher, with some studies suggesting prevalence rates approaching 40% in certain populations. Most of those people have no idea. If you have persistent right-sided abdominal heaviness or a sense of fullness that is new and not explained by your diet, please bring this specifically to your doctor's attention. A liver ultrasound is a non-invasive, radiation-free imaging study that can provide a great deal of information about liver size and texture. It is a reasonable thing to ask about. Sign number 1. The sign that I consider the most important of all 7, the most actionable. The one that, when I describe it to patients, they look at me and say they have been noticing it for years and never connected it to anything. Confusion, forgetfulness, or a change in your mental clarity that is new, that is inconsistent, and that no one has been able to explain. Not the forgetfulness of not sleeping well, not the occasional name that slips your mind. A fogginess, a difficulty concentrating that comes and goes, a sense that your thinking is slower than it used to be. Episodes where you feel disoriented or mentally sluggish in a way that is new and that does not match your normal experience. I have had patients describe it as thinking through fog, as feeling like they are a half-second behind in conversations, as finding it harder to follow complex plots in books or films when they never had that difficulty before. And every one of them had been told it was probably early memory changes from aging, or stress, or anxiety. In some of them, it was not. In some of them, it was a condition called minimal hepatic encephalopathy, a state in which the liver's reduced ability to clear ammonia and other neurotoxic substances from the blood is creating subtle but measurable cognitive effects. Not enough to show up on a basic Alzheimer's screening, not enough to be immediately recognized as liver-related, but enough to change how a person thinks, focuses, and processes information day to day. A 2021 study published in the American Journal of Gastroenterology estimated that minimal hepatic encephalopathy may be present in up to 30 to 40% of adults with compensated liver disease, meaning liver disease that has not yet produced dramatic symptoms. And the study found that in the majority of those cases, neither the patient nor their primary care physician had connected the cognitive symptoms to the liver. The connection can be tested. There are specific assessments, the psychometric hepatic encephalopathy score, and other validated tools that can help identify whether cognitive changes may have a hepatic origin. If you have noticed changes in your mental clarity that feel inconsistent with your overall health picture, that have been attributed to aging without other explanation, this is a conversation worth having with your doctor using that specific language. Ask whether your cognitive symptoms could have a metabolic or hepatic component. That question changes the direction of the evaluation entirely. Now, here's what I need you to understand about all 7 of these signs. None of them alone is proof of liver disease. None of them requires panic. What they require is attention, specific, targeted, informed attention, the kind that comes from knowing what you are looking for and asking the right questions. Because here's the truth about the liver that I want to leave you with. The liver is the most resilient organ in your body. It can regenerate from damage that would destroy other organs completely. In early to moderate stages of dysfunction, with the right interventions, with the right support, with the right changes to what you are taking and what you are eating and what you are asking your doctor to monitor, the liver can recover in ways that are genuinely remarkable. But that recovery has to start with recognition. It starts with someone noticing the signs that no one told them to look for. It starts with a patient sitting down with their physician and saying, "I have been reading about liver health and I want my liver enzymes checked specifically. I want an ALT, an AST, a GGT, and a bilirubin. I want to know what my albumin level is. I want to know if my liver is under stress." That conversation, that specific request, that is what changes the outcome. So here is what I want you to do right now. Take out a piece of paper or open the Notes application on your phone. Go through each of the 7 signs we discussed. Skin itching without obvious cause. Any change in the whites of your eyes. Changes in your stool color, consistency, or odor. New or unexplained bruising. Persistent fatigue that does not improve with rest. Abdominal fullness or pressure, particularly on the right side. And any changes in your mental clarity or cognitive sharpness. For each one that applies to you, write it down. With how long you have noticed it, with how consistent it is. Bring that list to your next appointment. Do not present it as a general complaint. Present it as specific, dated, observed clinical information. And then ask for the liver panel by name. Because here is what I have learned in 20 years of practice. When a patient walks into a 10-minute appointment with a general concern, it is easy for that concern to get triaged down. When a patient walks in with a specific, organized, informed question, the conversation goes somewhere completely different. You deserve that conversation. Now, there is one more layer to this that I want you to be aware of. Because many adults over 60 are taking medications, either prescription or over-the-counter, that directly affect liver enzyme levels. And knowing which ones and in what combinations can matter enormously for how your liver test results are interpreted. I am going to cover that in detail in my next video. Make sure you are subscribed with the notification bell turned on so you do not miss it. Before I go, I want to hear from you. Of these 7 signs, which ones have you noticed? How long have you been experiencing them? And has your doctor ever specifically checked your liver health at a routine appointment? Tell me in the comments, because your story, your experience, the specific way this is showing up in your life may be exactly what helps the next person watching this video recognize what is happening in their own body. I'm Dr. Richard Whitfield. Take care of your liver. It has been quietly taking care of you your entire life. I will see you in the next one.